Good morning, Martin.
Good morning.
So, to our viewers, Martin came to us from Dubai. You were diagnosed with atrial fibrillation. When did that happen?
It was the 19th of February.
And what did you think when you got the diagnosis of atrial fibrillation?
I was a bit panicking, of course.
Mhm.
Where are we heading? Since I have a traveling business, I travel lots of places.
Yeah.
All of a sudden, my whole life was changing.
So, what did the doctors there recommend for you?
Lifelong medication,
Hmm.
and we started doing a cardioversion.
Did that help?
No, yeah, for 3 hours. So, yeah.
The problem with cardioversion, it's a limited treatment. It helps you to get out of the acute atrial fibrillation, but it doesn't cure the atrial fibrillation, doesn't deal with the cause. The cause comes from the pulmonary veins. These are little electrical impulses which are sent and cause AFib. And the AFib is the pulse, the irregular pulse you feel.
Well, I had another one in the Netherlands, actually, 3 weeks ago. More or less the same story. This one held for 2 days.
Okay.
And that's it.
Yeah. And so then you wanted to inquire about ablation treatments.
Yes, especially because I tried multiple types of medication, and nothing lasted for more than a few days.
The current data, the current guidelines recommend aggressive ablation treatments, even as first-line treatment. So before we even give patients lifelong medication, we do an ablation treatment because we have a higher success rate. The earlier you do, the quicker you do an ablation, the more sustainable, durable the results are. So you inquired about an ablation treatment, and that's how you found us?
Yeah, well, I inquired, and also, of course, what waiting time would be involved.
Yeah.
And that's where the big shock came. In Holland, a few months.
Few months, yeah.
Germany was 1.5 months until I found you. It was less than a week.
Yeah, well, with us, these are our routine procedures. We perform 3 to 4 ablations per day. We do it on a same-day discharge basis. So you came to see us the day before yesterday. Yesterday the procedure, and last night you slept in the hotel room.
Yeah, and I have no words to explain how well this feels back to my old normal. And
but we can't perform miracles. However, the success rate, is pretty good. Today you're feeling better. I hope it'll last. During the first 3 months, AFib can come back. We call this the blanking period. Doesn't mean it's a failure. It just means that your heart is adapting to the new situation. The ablation itself can also cause atrial fibrillation. That's why everything needs to cool down. But once you're past these 3 months, I think you should be fine. So thanks for coming to see us.
Thank you for this help and this positive change in my life. More than great.
Okay. Now the ball is in your camp. You lose a bit of weight, become fit, you will be able to have the best circumstances to keep the AFib away.
I would hope so, since I'm alive on the sailing vessel, so I can't use any trouble.
Okay. Take care.
Thanks a lot.
Bye.